Have you ever wondered how coronary artery bypass surgery works? Let's break it down in just 70 seconds. First, let's start with the heart. When arteries become blocked, they can't supply enough blood to the heart muscle. That's where bypass surgery comes in. The patient is put under general anesthesia, so they're asleep and pain-free. The surgeon makes an incision down the middle of the chest to access the heart. Next, they take a healthy blood vessel from another part of the body, often the leg or chest. This vessel is called a graft. The surgeon then attaches the graft to the blocked artery, creating a new pathway for blood to flow. This bypasses the blockage and helps restore blood flow to the heart. After the grafts are in place, the surgeon carefully stitches up the chest and the patient is moved to recovery. And that's it. Bypass surgery helps improve blood flow and can really make a difference for heart health. Don't forget to like and follow for more health tips. Ever wondered how doctors remove your appendix? There are two ways: open and laparoscopic appendectomy. Let's break it down. Both surgeries remove the appendix when it's inflamed, but how they're done. First, laparoscopic appendectomy. With this method, the patient is put under anesthesia, and the surgeon makes 3 tiny incisions in the abdomen, each less than an inch. A small camera goes through one incision, showing the surgeon a live view on a screen. Special tools enter through the other incisions to remove the appendix with precision. The appendix is separated from the surrounding tissues, clamped off, and removed through one of the small incisions. The surgeon closes up, often using dissolvable stitches. Next up, open appendectomy. In this method, anesthesia is still used, but the surgeon makes one larger incision, usually about 2 to 4 inches long, in the lower right side of the abdomen. Here, the appendix is removed directly through the larger incision. This method is often used if the appendix has ruptured or if there's infection that needs to be cleaned out. Once the appendix is out, the incision is stitched or stapled shut, and recovery may take a bit longer than with the laparoscopic method. And that's how open and laparoscopic appendectomies are performed. 2 methods. One goal, removing that inflamed appendix. Ever wondered how balloon sinuplasty can help clear up your sinuses? Let's dive in. First, your sinuses are tiny air-filled spaces around the forehead, eyes, and cheeks. When they get blocked, it can cause pain and pressure. Here's how balloon sinuplasty works. During the procedure, a small balloon catheter is gently inserted into your sinus cavity. The balloon is then inflated, which opens up the blocked sinus passages. This helps to clear out the mucus and relieve the pressure. The best part? It's minimally invasive. Most people can go home the same day with little downtime. And that's it. Balloon sinuplasty can make breathing easier and help you feel better quickly. If you're struggling with sinus issues, it might be worth a chat with your doctor. Hope you found this helpful. Don't forget to like and follow for more tips. See you next time. Ever wondered how doctors can restore blood flow in your arteries using a small balloon? That's angioplasty. Let's break it down. First, the patient is prepped and given local anesthesia. A thin, flexible tube called a catheter is inserted through an artery in your wrist or groin. The catheter is carefully threaded through your blood vessels all the way to the blocked area of your heart. Once the catheter is in place, a small balloon at its tip is inflated. This pushes the plaque against the artery walls, opening up the blood flow. In many cases, a small mesh tube called a stent is left behind to keep the artery open. It acts as a scaffold for your artery. Afterward, the balloon is inflated and removed, leaving the artery open so blood can flow normally. Patients often recover quickly and feel much better soon after. Angioplasty is a life-saving procedure that restores healthy blood flow. Follow for more health tips and medical insights. Ever wondered how your body filters waste and turns it into urine? Let's take a journey through your kidneys. It all starts when blood enters your kidneys. Your kidneys are like filtration factories, working non-stop to clean your blood. Inside your kidneys, there are millions of tiny filters called nephrons. These nephrons filter out waste, excess water, and salts from the blood. The waste, water, and salts mix together to form a fluid called filtrate. which will eventually become urine. Next, your body reabsorbs any useful substances like water, glucose, and certain salts back into your blood from the filtrate. What's left behind, mainly waste and extra water, becomes urine. This flows through collecting ducts in the kidneys. The urine travels down two tubes called ureters and is stored in the bladder until you're ready to release it. Finally, when you go to the bathroom, your bladder contracts, and urine is released through the urethra. And that's how your body gets rid of waste. Follow for more fascinating health insights.